This is Mountain Health Minutes. I'm Ted Owens, your host, and today I have the pleasure of speaking with Dr. Brian Evans, the Chief Medical Officer of the Tahoe Forest Health System. Dr. Evans, how are you today?
I'm good, Ted. Thank you.
Good. Today, Dr. Evans, let's talk a little bit about urgent care versus the emergency room. And I know that there's several different opportunities for care in the community. What are they, and what's the difference between urgent care and an ER?
Yeah, it's an important question, Ted. I'm glad you asked it because a lot of people do have confusion about what is the difference, what are the different capabilities of the emergency department versus an urgent care, and when should they pick one versus the other. What I like to tell people is that, first of all, an emergency room is really there if you have a life-threatening condition. So a condition like a heart attack or a stroke or severe bleeding, something along those lines, or a severe injury, badly broken bone, deep cut, head injuries, those types of things, or symptoms. So if you're having symptoms that could be something serious, like you're having chest pains, you're having difficulty breathing, a patient with seizures, for example, maybe severe vomiting or diarrhea, those are all things that really should make someone think about an emergency department as opposed to an urgent care. Confusion is another one, or abdominal pain. And the reason why is because emergency departments really have a broader ability to take care of all patients. They have equipment and personnel that's staffed 24/7. There's just a much broader range of what can be done very rapidly in an emergency department versus an urgent care setting. That said,
Dr. Evans, I have a question though. Someone might present in an urgent care environment. If it's deemed in that environment that it might be a little bit beyond urgent care, they can be immediately referred to an ER. True?
They can be, absolutely. There are certainly situations where a patient might be redirected to an emergency department for an additional workup or a consultation with a specialist physician, for example. Sometimes they might need a CT scan, which is typically not available in an urgent care. And so sometimes those patients need to go by ambulance to an emergency department. Other times they can be transported by private vehicle, kind of depending on what's going on. So urgent care is, a good place to start for things that you don't think are serious. But I like to tell people it's always best to err on the side of going to an emergency department if you're concerned that you might have something serious.
Well, Dr. Evans, I appreciate the conversation, and full disclosure for the folks at home, you spent quite a few years as an ER doctor, so thank you very much for joining us today.
You're very welcome. Thank you.
And for the folks at home, this is Mountain Health Minutes, and I've been speaking with Dr. Brian Evans of the Tahoe Forest Health System. Thanks very much for tuning in.